Mike Gibson, John Dodson, and we're coming to you live from AHA 2025, and we're talking about the Better BP trial. Talk to us about the trial.
Well, thanks for having me. Very briefly, this was a trial that tested whether behavioral economics was effective in increasing adherence with antihypertensive medications and also whether it could lower systolic blood pressure. And we enrolled patients from our public hospital system. There were 400 participants, and we had a strategy that followed patients for a total of 12 months, and they were randomly allocated to either behavioral economics incentive lottery versus a control condition. And we found that using behavioral economics from baseline to 6 months actually doubled the rate of antihypertensive medication adherence. So it was 30, I think 34% in the control arm, 71% with behavioral economics. So it's quite, a positive effect, but there was no change in systolic blood pressure from baseline to 6 months. So even with the strategy of using behavioral economics, where people were incentivized with these financial incentives to take their medications, there was no change in blood pressure. The other interesting finding from the trial was that when we removed this incentive from 6 to 12 months, adherence went back to what it was before people enrolled in the trial. And so between 6 and 12 months, adherence was similar in the intervention and control arms.
And at the end, when they went back, was the blood pressure the same as well?
Blood pressure was similar in both groups. What happened from baseline to 6 months is that there was a drop of about 7 millimeters of mercury in both arms. And from 6 to 12 months, there was a small increase in the control arm, but nothing was a significant difference. And so our primary endpoint was baseline to 6 months. We had hypothesized that using this lottery, which essentially involves financial incentives that are tied to patients' adherence, would lower blood pressure, and it was powered for a 10-point difference, 10 millimeters of mercury. So, we're wondering and trying to explain why there's a disconnect between the effect on adherence and the fact that there was no change in systolic blood pressure. And we have a couple ideas, but nothing that's definitive.
Right. Well, interesting. I would have thought the same. I would have thought better adherence would lead to better blood pressure reduction, but I look forward to you guys telling us how that may have happened. Well, John, thanks for joining us today, and thanks to all of you for joining us here live from HA 2025.
Thanks for having me. Take care.
Thanks.